Hello. This video we're covering rupture of membranes. So what is it? It is the onset of labor. And this doesn't matter when in gestation it happens. It just signals that we're going to have the onset of labor. So what's going on here? We got a couple things going. So one of the things we can do is artificial. So it doesn't happen. Normally it's just a spontaneous rupture, signals labor, baby comes out, everything's great. Sometimes we have to go in there and the doctor is just going to prick that a little bit, make it rupture, and then you're going to get that gush of fluid. And that's going to signal the onset of labor. If they were to look at an ultrasound after there was this rupture, that amniotic fluid index that we used to look at would just be down. So you want to be able to see much amniotic fluid in there. If you were to have this pooling of fluid and you wanted to know, is it actually amniotic fluid? Is it something else? We could run a little test on it and it would come back positive for what's called ferrin. And it would be positive for this other one, nitrazine. So if we had to determine if it was really amniotic fluid or not, we'd run that test on it to see. So that is the regular way it goes. So we can have, of course, it goes the opposite way, is premature. So this is when it happens before the baby's ready to come out. And it can be due to a lot of factors going on. Some of those include like your infection, so maternal infection. Let's draw our infection guy here. So it looks like it's green sun, but that's our infection. This may be the STDs, STIs, whatever we call them these days, or just other infections. So big infections, not like a cold or anything like that. We have toxins, so environmental toxins. This includes your things like tobacco is our main one on that guy. So draw our little cigarette there to know that that is one of our complications. Cigarette, okay. Down just a little bit more. So multiple, so twins or more. Just there's too much going on in there. It stretches the sac and it ends up rupturing a little bit too early. And then lastly is just a genetic predisposition. So for whatever reason, that sac wasn't very, and the integrity wasn't the best, so it just went out a little early. And this can include some things like incompetent cervix. It's one of the big ones there. So any of these things that can cause it are due to what's called accelerated membrane weakening. So anything that's going to cause that is going to lead to your premature rupture of membranes. Now, one thing that can happen though is it happens a little too early. So this is early, and this happens when it's really early. So we have our premature, which is prom, and we have preterm, which is pre-prom. So this is when it's occurring less than 37 weeks gestation. So this has happened really early. Again, it's the onset of labor. It's coming way too early at this point, and we're going to run into some problems with that. Let's go to our other side we have is just prolonged. So it happens, we have our rupture, and it goes on for essentially what we like to call it is 18 hours. 18 hours, that's when we start classifying it as saying it's prolonged. This can be due to a couple things. It could just be a long labor. So labor that's just taken a little too long. Again, we know some people who have, or some groups that have problems with that are prime gravas. Prime can be a little bit of a long labor. It can be just failure to progress. Another good one that we have for that. And there's a couple special groups. So in terms of the groups that might have a long labor, these are older women, ones with increased BMI. So high BMI causes a lot of problems. This is one of them. And another one that jumps up is need for oxytocin for induction. And the use of epidurals. So these groups can specifically have a little bit of a longer labor and cause some problems. Now, that's going on our mom's side. So on the baby side, a couple things can go on. So if this happens really early, so when the lungs are still developing, we can cause some problems. So we're losing this amniotic fluid. We can end up coming too early. We go down to our oligo. So we have too little amniotic fluid. And one of the bad complications we can end up is that pulmonary hypoplasia. So there isn't enough fluid and the lungs fail to develop. And that's one of our big complications with it. Now if we have premature rupture or prolonged, so it's going on for a little bit too long, a couple things that can go on. So we have all that normal flora hanging out down there, and it can lead to what we call chorioamnionitis, or just a chorio, which is an infection, a maternal infection, or an infection on the maternal side. So if this happens, it's called chorio. So these can all lead to chorio because there's been too long of a time period going on. So it's a potential pathway for this bacteria, anything like that to come in. Now let's talk about chorio just a little bit because there's a big one about that we'll have to talk about a little bit more. So first trimester. So if we have this occurring in the first trimester, it's going to be usually due to some kind of abnormal cervical vaginal or flora. These are things like bacterial vaginosis, and aerobic vaginitis. And if this happens, or we get this infection early, a couple things can go on. Big one is just the preterm birth. That's what we're going to be worried about, is preterm birth with this chorio, because we're going to have preterm delivery with the potential infection of this baby, which can cause a lot of problems. If it happens really early, it just might miscarry, so spontaneous abortion. And if there is chorio too, we're looking at mom's side of things. So we have two types of infections we're going to be worried about. We're going to have to classify. So we want to know, is it an acute infection or subacute? This just means, what are the symptoms? So in acute, you can imagine, there are symptoms. Subacute, there may not be symptoms. And these are symptoms or preterm labor for the acute, or either of these. So with our acute, these agents here, that bacterial vaginosis and those aerobic agents, can cause it, along with a couple of other things that are you're going to hear a lot about, is that group beta strep. So we swab all the moms for it, but sometimes if it's positive, it can cause up that infection going up to the chorio. We can have E. coli infections, E. coli, and another one that we see pretty frequently is the Streptococcus viridans. With these, so these can lead to some outcomes or some cause problems with our babies. Again, sepsis. So mom has an infection, transfers over to the baby, and it causes some problems. respiratory distress. It's not respiratory distress syndrome, but respiratory distress we'll talk about in a different video. And lastly is just our cardiac instability. So we're just going to draw heart. We're going to say unstable. All right, now moving over a little bit without symptoms. So the agents on this guy are going to be ureaplasmin, that urea, which is a really interesting bacteria that can cause some infections, and the Gardnerella vaginalis. And with these, if we have these infections going on, it causes some outcomes for our baby. Symptoms are variable, so we're not exactly sure what these babies are going to look like, but we have a couple ideas. And then if it causes like real infections that we're not knowing about, it can cause a couple things. One of the interesting things specifically with this ureaplasma is chronic lung. So there's some evidence that suggests that if we have this ureaplasma infection, it causes some complications in the development of the lungs, an early lung infection leading to inflammation, and then development into BPD long term. And other problems with like birth injuries and everything like that is just our brain injuries. So leading to those type of symptoms. All right. So when we're talking about rupture of membranes, we have our spontaneous, which is just SROM. We have artificial, which is just AROM. We can test the fluid to see if it's really amniotic fluid or not. If it happens premature, it can do to anything that's going to cause accelerate membrane weakening, to include all our factors here. If it happens really early, less than 37 weeks, we call it PPROM. It can be prolonged if it's over 18 hours due to long labor for a bunch of different factors. The baby can have some problems with oligopulmonary hyperplasia, and all of these can lead to choreo, which can be acute with symptoms, subacute without symptoms, and lead to a lot of different complications with our baby. So that is all we have for this one. We'll talk to you soon.